Frostbite. Part 22, Frostbite. Welcome to the lesson on frostbite. In this video, we will discuss causes, symptoms and care for frostbite. Frostbite. Frostbite is a result of exposure to cold and is most common in ears, nose, fingers, and toes. Wind chill increases the risk of frostbite. In severe cases, ice crystals form in the tissues and destroy cells, causing permanent damage. In case of frostbite, the skin appear waxy and white and yellow-gray. The frostbite area is cold and numb and may feel like a block of wood. The frostbite tissue is firm and does not move or compress easily when squeezed. However, do not try to rub, squeeze, or scalp the affected extremity, as this may increase tissue damage. How to care for frostbite. Step 1. Get them to a warm place and call 999/EMS. Step 2. Remove any constricting clothing and all jewelry from the affected body part. Remove all wet clothing. As well, redress them in dry, warm clothing and cover them with a heavy blanket. Step 3. Put the areas affected by frostbite in warm, not hot water. The temperature should be comfortable too. The touch for unaffected parts of the body. Step 4. Do not rub, squeeze, or slap the affected extremity, as this may increase tissue damage. Step 5. Do not rewarm a frozen extremity if there is a risk of refreezing. Step 6. Seek further care from a healthcare professional. This concludes our lesson on frostbite. Next we will review hypothermia.